Hi guys, welcome back to my channel. So in this video, I'm gonna open this flashcard box that I bought from the online store of Level Up RN. Again, to Miss Nurse, to Nurse Cathy, hello, hi. I got one of your flashcards over here because again, I'm in nursing school as well. So sometimes like it's fun to actually get some other resource to actually study. Again, I'm not really into flashcards kind of person. I'm kind of just more of a highlight. But I'm gonna try if this one would actually help me out as well. On top of again, in nursing school, I know it's we have a lot of actually books already that we have to read, like notes, PowerPoints, videos, and the ATI books as well. So it's a lot of information. So hopefully this one can I kind of digest all of that and summarizes and kind of hit the key points. Because again, I was watching the videos of Miss Cathy and her team also, especially the chicken hints that they give out clues that they were gonna tell you what is coming out of the exam or what's gonna show up in the actual NCLEX. So it's gonna cool thing. So I have this one again. It says here. I bought the maternity one from Level Up RN because this one is one of the courses that I'm gonna take next month. Fall starts next month, so hopefully this one would cover most of the things that we had to learn in school. And if I like this one, I might buy also the pediatrics because pediatrics is also one of the courses that we had to learn this coming semester. So let's go ahead and kind of take a peek of what's on the box over here. So here it says here, I am an RN with experience in critical care and ED. I recently accepted a position in OB maternity. I was anxious about how little I knew on the subject, so I watched your YouTube videos and read the flashcards. They were so helpful, and I didn't really feel unprepared for the start of the orientation at all. Everyone's impressed with the knowledge base, especially considering that I didn't have any OB experience. Elizabeth. So the back part of the box would be, again, this one is the cool chicken hen. It's like the logo over here. Only the information you need. So it's basically they kind of highlights the important things that you actually have to remember. So all right, let's see what's inside. I'm gonna be careful a bit in opening this one because I don't want to scratch the box. So I'm gonna go outwards in this one and just peel it off the box. Yeah, I do like watching YouTube videos for, especially when trying to study for ATI or just other stuff, just for learning and fun also. Because again, nursing is really broad, and so every nurse also have their own experience in their field. So not everybody has the same experience. Because I noticed that in clinicals, sometimes you want to do a lot of hands-on, but sometimes you don't get patients that would allow you to do that. So sometimes it's going to be a slow pace, but sometimes there are days or clinical days that there's a lot of non-stop patient coming through and they all needed a lot of intervention. So and they keep you busy all the time. So it's kind of it just varies what's going on sometimes. So all right, so I'm going to open this one. Nursing flashcards. Cool. Alright, so you would see this one, right? So she was saying that again it's arranged based on topics, but overall it's maternity, right? So over here subtopics would be preconception. There's also pregnancy, labor and delivery, newborn care, okay, postpartum care, and then index over here, the back part. And what's in the back part over here? So this one is new. I'm not sure if this is extra. Learning, new learning, and back part of the, and then leveled up over here. It is when you're actually finish all the topics. So again, let's see, because they were saying, all right, so I'm gonna pick one. It's cool that it's arranged based on the the stages of pregnancy, like preconception, and goes on to like actual pregnancy and delivery and then newborn care and so on. So it's not like disorganized, like everybody's in their own place. So it's like a sequence. Let's try this one. All right, so labor and delivery. So over here in the first part, risk factors, signs and symptoms, complications, nursing care, and then the back part is precipitous labor lasting less than 3 hours from onset of contractions to the time of delivery. Risk factor. It just tells you risk factors would be hypertensive disorders, oxytocin, younger maternal age, preterm delivery, lower infant birth rate, placental abruption, signs and symptoms, SS, abrupt onset of intense contractions, complications, maternal lacerations, tissue trauma, uterine rupture, postpartum hemorrhage, fetal hypoxia. So over here, they highlight the postpartum hemorrhage because I think that's the main thing that you have to actually remember with the precipitous labor. And then nursing, I forgot what's the NC. Is it nursing care? Okay. Encourage patient to remain in a side-lying position because that would help the patient. Then as a nurse, you have to administer oxygen, IV fluids is ordered. Discharge oxytocin. I forgot the DC. Oxytocin if being used, and assist with emergency delivery. All right, cool. And let's do one more before I. All right, let's do the this one. All right, what's this? Heel stick. That's why I don't even know. All right, illustration. So this one is illustration. All right, so this one is the heel stick. So if you're looking at the foot right over here, heel stick would be like the sides on the bottom of the heel. Yeah. All right. And then for index, I think this one is like the one that has the all what are included in the flashcard. So yep, so we have starts with A, from abruptio placentae, and so on and so forth. So, and then they were saying, because again, the front part of the card is like matte, like shiny side, and then because some people likes to write stuff, right, and then highlight. So the back part, actually you can actually write something over here. Depends on whatever you want. It's like if you want to keep it clean a bit, just you can use pencil so that if you wanted to erase it, you can still erase it. But can use pen also over here, or highlighter also. So whatever works for you. So, but yeah, it looks like it's gonna be useful for me, and then helps me become organized too. Because again, trying to learn some stuff over here too. All right, so last part over here, I'm just looking at the leveled up. If you don't need any prompting to remember the material on a card, place the card behind the stamp. Congratulations, you've leveled up. So basically, you learn, the course. And it's also cool that there was Nurse Cathy, also our level up RN. She was saying that, they have the videos online. So when I purchased this month, I also had the chance to get free month of subscription to their website with the videos. Right, so you can use these actual flashcards when studying together while watching the video, so that you can actually follow along, and then it kind of boosts your memory and actually how to study for your test. So it's really cool. So all right, let's see if I'm gonna get a good grades. I'm gonna get a good grades. And hopefully I enjoy this course also, maternity nursing. Alright guys, thank you for watching. Take care.